Hi, my name is Dr. Nikita Vizniak, and I'm here with the amazing
Magdalen Farley.
And the amazing
And
today we're going to talk about some pregnancy massage and joint mobilization. So with that in mind, we're going to go ahead and pass that off to Magdalen, who's going to direct us through the rest of this process.
Thanks very much. So thanks so much for joining us, Danica. So we're going to talk a little bit today about taking first a thorough history of pregnancy. We're going to talk a little bit about your general reproductive history, as well as your current symptoms. And then we're going to go to showing a little demo of the use of the pregnancy pillow system, go through a little bit of treatment, and then towards the end, or possibly in a future video, we'll be talking about massage therapy for labor and delivery.
And believe it or not, that is a real thing.
That's a thing.
If you can have a massage therapist during your birth, that would be golden. I think all moms can agree, yes.
We are going to go through a little bit of a history right now. When it comes to pregnancy, one of the biggest differences in pregnancy massage is the history you have to take. You got to get a lot of information in order to make sure that you are being safe, checking for any complications, and also, of course, getting an idea of what symptoms your patient is suffering from in order to best treat them. So first and foremost, how many weeks are you at?
21 weeks.
21 weeks, okay. And is this your first pregnancy?
It is my second.
Excellent. How long ago was your first?
Mason just turned 2 last month.
That's exciting. Did you have a party?
Yes.
Okay. So before your pregnancies, did you have any major reproductive complications or anything like that?
No.
Okay, no PCOS, endometriosis, problems with blood pressure?
No.
Okay, that's excellent. And did you have any trouble conceiving?
No, we were really lucky.
And how did your first pregnancy go?
It was good. I just suffered from pelvic malalignment and carpal tunnel syndrome.
Okay. Now, when they suffer from conditions like that, obviously you want to check if there's any recurrence with this pregnancy. So how is this pregnancy going with regards to that?
It's good because I ended up having surgery. So
okay.
Yep.
Excellent. Now, that surgery healed well, no problems with the scar tissue?
Yep.
Okay.
No.
How long was your recovery time?
It was about 6 weeks for each side.
Okay. And the pelvic malalignment, was that pretty severe, that pregnancy?
It was, and it started pretty early on.
Okay. And how about with compared to this time?
This time it didn't start until later, and it doesn't seem as bad as it was last time.
That's an improvement. Okay. So what about things like belly itching?
Yep.
Okay. Any calf cramping?
Yes.
Significant nausea?
Nausea in the beginning, not too much vomiting, but lots of nausea, kind of lightheadedness, but it's gotten better now.
The same with both pregnancies?
Yeah.
Okay. And with your last pregnancy, did you have any major complications, placenta previa?
No.
No preeclampsia or anything like that? That's excellent. How did your labor go with your first?
It was really fast.
Nice. Any particular complications with that?
No.
No? Blood pressure stayed even?
Yeah.
Okay. And there was no C-section?
No.
Any major tearing?
No, just a tiny one, but I didn't get any stitches.
Excellent. Okay, so with regards to this pregnancy, what are your main areas of concern, pain?
Mostly hips, glutes, calves.
Calves, you're still having that calf cramping, but no recurrence of that. Any sciatica, pain running down the leg?
No, not.
Okay. What about swelling in your feet or ankles?
Nothing yet.
Okay.
My last pregnancy, it didn't really happen until about like the last month or so.
Any particular headaches?
I had some in the beginning. I had some sinus problems, but it's been better now.
Okay. And you had said you're having a bit of heartburn?
Yes.
Have you noticed any major differences when you change position?
It's worse if I lay down flat.
Lay down flat.
Up, it's better.
That is the usual case. Okay. What position are you usually sleeping
on either
in?
side.
Either side. Okay. And the doctor hasn't made any particular recommendations? Okay, that's excellent. So that means that you should be okay lying face down. You don't find that that increases your heartburn?
No.
Okay, excellent. What about pain in the shoulders, chest area?
Yeah, it's kind of a little tight.
Okay. Have you noticed a significant increase in your breast size?
Not significant. I stopped breastfeeding not too long ago, my last son, so...
All right. So no major increase in heaviness on pulling on the front of your chest there?
It's kind of continued from last time.
Okay. And what are your main concerns for today's treatment? What would you like to focus on?
Hips, glutes, calves.
Those are the things. Okay, perfect. So that gives us our good jumping off point for what to deal with. We've checked about some contraindications, complications, anything to be aware of for future. And then at some point we are going to discuss the possibilities of labor massage because that is indeed a thing that you can do. Did you have a significant support system for your first?
I had my husband, my mom, and my sister in the room with me.
Okay.
I had intended to call you, but baby came too fast.
Came too quickly. Alas, that is all right. Okay, and have you got a birth plan organized for this time around?
Kind of the same thing, get to the hospital right away.
Good idea. Okay, perfect. So that gives us our jumping off point. Now we can get going with treatment. Okay, so first we're going to go a little bit now through the use of the pregnancy pillow system, how to get on and off the table, going from face down to face up, etc. As you know and have experienced, it can be a little awkward. We just like to embrace that. There is no not awkward way to get on and off the table, and we are, as we can see, draping for two. So we're going to just show how to set up with the drapes. Some pillow systems are a little bit different. Some do not or don't come with a face piece. Some pieces don't actually have that kind of tapered bottom piece to allow for a more comfortable position for the thigh. So you sometimes have to work around that with extra pillows. No big deal. So first we're just going to show how to get this set up. You put the face piece over top of the hole in the table, or on top of, if your table has a separate face piece on it, you just put that over there. And you set up your draping as you normally do. This is the behind the scenes for Danica because she's not the RMT. So we're going to just get that set up there. And then, if you don't mind, I'm going to ask you to hold the top sheet here while I get this bottom one on. It's good to have fairly large drapes for these systems just because you are, again, draping for two and you want to have a lot of room. It does take up extra space on the table, so it's good to have larger drapes. So we get that set up, and I always make sure that there's lots of space there because, of course, if you start with it in that position, belly sits down and now it's not actually covering the entire piece. So you just kind of get it all set up with the extra space there, and then put the, again, large drape over top, especially for the top drape, because once you've got a extra two people on the table, it is going to kind of drape across them, and you want to make sure that you are allowing for the most coverage for patient comfort and privacy. Pretty much just like a regular system. All right, so that is how we get set up on there. Now what we're going to do is kind of get Danica to show us with clothes on, obviously, but your patient will be doing this when you have left the room undressed. So what you're going to do, Danica, is I always explain to my patients how to get on. So Danica, when you're getting on the table, you're going to climb on top. You want to have your belly, you kind of hover your belly and get into position over top of that hole in the pregnancy pillow system. There's also a little base here for breast tissue, and then you're going to put your face down in the face piece like you normally do, and you're going to pull this drape over top of you as much as you comfortably can. When I come back into the room, of course, I'll be able to help you get the drapes all settled. So without further ado, Danica, if you want to just climb onto the table as you normally do.
Again, it's never not awkward.
Never not awkward, and that's okay. There we go. Perfect. And how is that for comfort? Any problems in your low back?
No.
Okay, and now you can also put a couple of extra little pillows under here. My pillows have sort of a plastic overlay on them so that they don't slip out. If you have very slippery pillows, you might want to put extra draping around them just so that they stick to the sheets and they don't actually wind up slipping right out. We won't bother with that today though. Once we get into treatment, you do all of your normal treatment just like you would for any other patient lying prone, addressing the areas that your patient has indicated are worse for them. So in the case of Danica, we'd be working on low back issues, on glutes, down into treating the calves, because of course she's got that calf cramping, and then we would switch to supine, which is going to be more of a semi-Fowler's. Now that the baby has gotten to the 21-week stage, forgive me, baby is getting a little bit bigger, and the concern with lying supine is that the baby could sort of fall backwards and compress the uterine artery, which could cut off blood supply to the baby, which usually makes mom feel very uncomfortable and baby as well. So we are going to make sure to put her into the semi-Fowler's position for that. So when moving from a prone position to a semi-Fowler's position for that, this is, again, we always joke, is there's no way to do it not awkward, which is fine. So in this case, I'll make sure that I am still in camera at the head of the table. Excellent. So what we're going to do, Danica, now that we have finished treatment, we'll demo more detailed treatment in a minute. So what we're going to do is first, we have removed any extra pillows that are in here. You are going to lift your head up out. I'm going to just detach this entire piece, okay? And then I'm actually going to be asking you to go up on all fours. You want to keep your patient covered as best you can. So we'll pull that right out, one smooth movement, and then I'm going to come to this part of the table. Yes, my back is to you on purpose because your patient is normally undressed for this. Get them on their back. Perfect. Now I'm actually going to make you sit right up, Danica, And we are going to put one pillow lengthwise and one pillow crosswise and get you to lie right back. And how is that? Any discomfort?
No.
Okay, and then we would put an extra bolster under the knees as usual for all of our patients. And then from this position, we can treat the belly, we can work on that belly itching, a little bit of fascial treatment, some skin rolling, we can do any work for the legs, and of course neck and shoulders, just as you normally do for any other patient in this position. Okay, so moving on to treatment for pregnancy massage. I feel like this is going to be the part where there is less new information, because quite frankly, a treatment for a pregnant patient is pretty nearly exactly the same as a treatment for a non-pregnant patient, except that you get 2 people for the price of 1. So we are doing treatment for 2. But treatment for the low back, treatment for the shoulders, treatment for the calves is all very similar, but we're going to be addressing the areas that Danica particularly has told us are of the most concern at this point. So she has said low back, glutes. When I was talking to a former student of mine a little while ago, I need to stop that again, say it again, because that was a male student. I was talking to a former student some time ago and had him come and shadow me. He hadn't had the chance to see a pregnancy treatment while he was in school and was feeling a little nervous about it. So we were having a nice little chat after we had done some treatment on a couple of different pregnant patients. And the thing that he said struck him the most about the treatment was that it was exactly the same as a treatment for anybody else, and that really is the case. There is not a lot that you do that it is different. So when you're treating low back pain, what do? You've got increase in hyperlordosis because your center of gravity has been shifting forward. So we do a lot of fascial release. We're peeling the tissue away from the spinous processes. We're going to be getting into the glutes a little bit. So lots of nice compressions. With your permission, Danica, I'm just going to undrape this leg. Now, our patient has left her trousers on for this particular treatment, which is just fine. We can always work through. So I'm going to be getting in, working on those glutes. One of the things you do have to consider when you are treating someone who is pregnant is they do have an increase of relaxin in their system, which makes their ligaments rather looser. That is entirely the point. It's going to make a lot more ligament laxity. So that is going to allow for the movement of the pelvis so that the baby can transverse down through the birth canal. But it does mean that things are looser in general, and of course that can lead to some instability. Muscles can go into spasm, so we're going to be treating that muscle spasm. So now we're going to get into a little bit of an active component. So I'm just going to hold on to that particular spot. Danica, I'm going to get you to push against me here with your leg. Perfect. How's that feeling? Any particular pain? Good pain, bad pain?
Good, just a little tender.
Awesome. We'll keep working through that, so keep me posted on that. We're going to work a little bit similarly through to the hamstring, so I'm just going to undrape from there. How's that feeling?
Tight.
Yeah, absolutely. So when you get that hip pain, Danica, is it limited just to the side? Does it radiate in through the back, through the front, down at all?
Through the side and then kind of across the back.
Okay, so we're going to work into all of those areas. Lots of fascia, lots of pin and stretch. We can get into a lot of nice Swedish, which I do have my lotion here. Do you have any skin sensitivities or allergies,
No.
Danica? Okay. I prefer to use lotion. I find it allows for me to have a better grip on the tissue. It also sinks into the skin so that if I decide that I want to do a modality like joint mobilizations or a fascial, then I don't have to go and wash my hands, try and get the oil off of the patient's skin. So that does make things a little bit easier to work with. But we can get in there and do lots of circulatory work. And then from this position is a good position to also address all of that calf cramping. Calf cramping is actually extremely easy to treat. A little bit of Swedish and you're basically good to go. Most of my patients have said that just a little bit of regular Swedish treatment, they come in, we do some compressions, we do a little bit of fascial, and then we get in there and just do a lot of our circulatory, petrissage, flushing, effleurage techniques, and they have no pain until the next time they see me, and it's really, really effective. So it doesn't take a lot to make a significant improvement of those particular symptoms. Just going to get you to, so I'm going to pin on this muscle. I'm going to get you to bring your toes to your nose, basically. You're going to bend your foot backwards like that. Perfect. How's that feeling? Any pain?
Just really tight and tight.
Okay, and then release. Perfect. And we're going to do that a couple more times. So stretch that foot. Perfect. And stretch again. Nice. I'm going to repeat that a couple of times. Work in through that calf. Is one particular area of the calf more sensitive?
Just right down.
On the outside. Now, is that where the cramps tend to hit when you get them?
Yeah, and then kind of the muscle at the top.
Right up at the top and through there?
Down a little bit. Yeah, there.
So where she's pointing to is the peroneals, and that is where we're going to focus some of that pressure as well. We're going to pull that muscle away from its attachment. So at this point, what I'm doing, I think you can see from the top, is grabbing hold of the peroneals and pulling them this way. Yeah. How's that feeling? Excellent. We will, of course, work equally bilaterally. Now, if she had said that it was worse on one leg than the other, we would focus on that particularly. So we're gonna. Now, I usually like to work a little bit of the upper shoulders as well. You said that you have had a bit of breast tenderness this time around. Now, do you mind if I ask if you've had a significant change in breast size?
Not yet. I mean, it's changed, but not significant.
Okay, so there's not too much increased weight on the front of your chest right now?
No.
Okay.
I nursed my last baby for quite some time, so I don't think there's been much change since then.
That's good. Continuing on with our treatment at this point, we're going to address some of the issues in the low back and the belly from this position as well. So we can get a lot of mobilization of the tissue in through here, as well as Danica has been complaining of some belly itching, which is very common in pregnancy. Happens a little bit more in first pregnancies because this is the first time that the belly has been stretching. So all of that fascia underneath the skin is pulling, and we can actually relieve a lot of that symptom. So I usually like to start, just like with any other belly treatment, it can be a little bit jarring if somebody suddenly grabs onto your belly and there's a whole other person in there taking up space and there to be a little bit confused. So first we'd like to start in from the sides and get a little bit of movement going. How's that feeling in through there? Good. And is one side of your low back bothering you more than the other?
No, about the same.
About the same? Okay. And do you happen to know what position baby is in at this point?
Baby's still a little bit low.
Yeah. You're only 21 weeks, so he's still got lots of room in there to be moving around, which is just fine. I'm sure he's doing his somersaults and hanging out in the swimming pool. So at this point, before I get going with any lotion, I want us to do some skin rolling. Now, if your patient has never had skin rolling, it's a good idea to little demo it. You can also show them how to do this for themselves. If the skin rolling is really effective for them, they can do it at home if the belly itching is really bothering them. So essentially what I'm going to be doing, see if I can, yeah, perfect. So I'm going to be forming a little bit of kind of a boundary here with my thumbs, and then I'm going to be picking up the tissue and rolling it along, hence skin rolling. Nothing is very creatively named here. That's just fine. So usually I'm going to focus that wherever the patient has said the skin itching is the worst. Where is that for you, Danica? Right across here? Okay. So, and did you have significant stretch marks with your first pregnancy?
No.
That is lucky. What's your secret?
Good genes, I guess. I don't know.
Absolutely. So we're going to be focusing in that skin rolling in through there. Now, is that uncomfortable, pinchy?
No.
Nothing? Okay, perfect. So we're going to come around, see if we can feel any kicks from baby. Do you happen to know if he's awake right now?
Haven't felt much recently, but
it's chilling out a bit.
Like a jungle gym.
Yeah, active boy. He's going to have to keep up with his older brother, right? So we're going to work through there. And again, we just keep going with that as much as we feel is necessary. Go with where the skin adhesions are that you're feeling, stuff like that. You've got some really good mobilization in your tissue through there. So I'm going to add some lotion now. See if we can get to massage 2 patients for the price of 1. Have you had any problems with your digestion in particular?
No, not really.
You're having the heartburn and stuff like that, but no diarrhea or constipation?
Constipation a little bit, but nothing like...
Okay.
Nothing exceptional.
Any major food aversions?
In the beginning, yes.
Yeah.
Smells and mean stuff. Not as bad as the first time around, though. The first time was really bad.
So I'm just going to have a little feel, see if we can feel baby. It's pretty early to be able to feel him at this point. Once they get a lot bigger, they're taking up a lot of space, running out of room. Yeah, he's pretty deep in there. Oh, but there he is. Hey, kid. We won't wake him up if we don't have to. Excellent. So this is also a good position to address any pain or tension in the front of the chest. So I'm just going to re-drape your belly here. So it's very common to get a lot of tension in through the front because, of course, with an increase in breast size, it's going to be pulling on the shoulders. So we like to do a lot of fascial work in through the pecs. Going to work through here. Now, is it all right with you if I work kind of in this front area? Okay, and if it's okay with you, I'm going to put my hand underneath your strap, okay? Perfect. Always good to get clear consent. Makes the CMTBC happy. We don't have to put that in there. Good.
I was going to tease you in the beginning and be like, you didn't ask for consent.
Okay, so moving back to, so working in through the pecs, I like to do a lot of pin and stretch through here as well. So I think I'll stay on this side of the table to demo that. I'm gonna get you to bring your arm out with you, if that's all right. And I'm just gonna, if your patient is not wearing a sports bra, you wanna make sure that that's nice and tight through there. So what I'm gonna do here is I'm gonna hold onto your pec here. I'm gonna push downwards on that. Perfect. Is that painful at all?
Nope.
Okay, perfect. So now we're gonna bring this arm up. How's that feeling?
Good. Just kind of tight.
Oh, nice little click in the shoulder. No pain with that though?
No.
Okay, perfect. So we're gonna bring that along there. Yeah, you got lots of good clicks. And we're gonna stretch that out. Nice. Okay, so we can do this actively as well if they're feeling particularly tight. So I'm gonna switch to this side of the table. I'm gonna tuck in that drape nice and tight, perfect, all nice and secure. So I'm going to hold on to your pec from this position, and then you're going to bring that arm up like you're doing a jumping jack, and then back down. Let me know if it's too painful or intense. This can be quite intense, okay? And you said that you were breastfeeding fairly recently? Okay. All right, so we're going to hold on to that, and you're going to bring your arm up. How's that feeling?
Good.
Nice stretch. Nice. Good, and back down. Perfect. And again. Do a couple of things of that. Beautiful. And you can repeat that as many times really as you need within patient pain tolerance. Another nice little technique that you can do, so to kind of open things up, I'm going to bring my hand, I don't know if we can see this, my fingers are sitting basically right beside the spinous processes. I'm pushing up into those costotransverse joints where the ribs meet the spinal column. Find that, move to the side, and then you can just relax that shoulder nice and loose. Perfect. And I'm going to be pushing straight up, essentially like that. How's that feeling? Okay. And then from here, I'm going to do a fascial pec shear across the chest. Feeling okay? So at the same time, see if it can be seen, I am pushing up with this hand and pulling out with that hand. And we're going to kind of open up that whole front chest region. From there, so we're going to push up. Comfortable still? Good. And we're going to pull across, and how's that feeling?
Good.
Excellent. You can just hold, just like your fascial holds usually. This is a really great maneuver for anybody who spends a lot of time with their arms rounded forward, people carrying their toddlers, breastfeeding as well in postpartum patients. Working in through there. Also, your non-pregnant patients, this is a good one for all of your desk workers, musicians who have their arms forward holding an instrument, dental hygienists, all of those people. What did you do for work when you were not on maternity leave?
Pharmacy technician.
Okay, and you are on your feet a fair amount for that?
Yes.
Okay.
And also at a desk.
At a desk, yeah, absolutely. How's that feeling?
Good.
Good. I'm going to address the neck as we normally would any patient in this position. Lots of distraction. We can do a lot of work on the upper traps from this position. You having pain up in your neck and shoulders?
Yeah, the usual.
Any significant headaches?
Not recently, more in the beginning.
Okay. You did say that your blood pressure was all good, though?
Yes.
Excellent.
Yeah,
so
more sinus problems.
Exactly.
So.
Yeah, so of course that is one of the flags. When you're working with pregnant patients, you want to be on the lookout for any potential complications that haven't yet been detected. Big one, obviously, is going to be high blood pressure and preeclampsia. So if your patient is suffering from significant headaches, they also have, you're looking for swelling in the ankles or feet, and then you want to double check what their blood pressure has been, because you want to keep an eye out for that. Now, as Danica did not have preeclampsia in her first pregnancy, it's less likely that she would have it in her second. If she had it in her second, she has a 20% chance of having it, or forgive me, if she had preeclampsia in her first pregnancy, she has a 20% chance of having it in her second. If she also had it in a second pregnancy, then she would have a 100% chance of having it in any subsequent pregnancy. It's just a matter of time. So at that point, it is important to be checking in and making sure that everything is all right. How you feeling through there?
Good.
Awesome. And now I think we're just going to finish up with some movement of your hips. You were saying that your hips are pretty uncomfortable this time around, so we're going to do some stretching out as well as working in through these little teeny muscles in the front, so keep me posted. They can be a bit tender. So since you have your trousers still on, that is going to be a lot easier to work with. So we're just going to undrape here. Are you okay there?
Yep.
So it's sometimes good to have your patient come in shorts or in leggings like this, because you can do a lot of things through the fabric, and then you can pick things up and move them around and not be as worried about keeping draping secure and stuff like that. So I'm going to work into the little muscle in here is your TFL. And then they make the face and we check in. It should always be within pain tolerance. How are you feeling there?
It's good. It's very tender.
Very tender? Okay, but it is within pain tolerance? Absolutely. So I'm going to hold on to that little guy there, and I'm going to get you to slowly lower your leg back down to the table. How's that feeling?
Good.
So that is a little bit more visible. I'm loading in here. Now, if you have wee little hands like myself, you can also use an instrument. It can be very helpful in that case, so that you're not overloading your thumbs, back bending them like that. It's very poor for biomechanics. So in that case, you can grab a little instrument, which magically I am just holding in my hand right here. So there's lots of different ways you can use these little tools. They're really, really excellent. They're meant to sort of approximate certain hand shapes. So in this case, there's a knuckle. In this case, there's a thumb. I'm going to use the thumb one in this particular position, so that I am not going to be hurting my wee little joints in my thumbs there. You can see from both, yeah, that joint right there. I do have that hyper mobility in that thumb, which bends it back like that. We want to keep them nice and straight. So in this case, I'm going to find our spot there. How's that feeling? Okay, get you to just push gently into my hand. Perfect, that's where we want to be. Okay, so I'm going to load that in. I'm keeping my joints nice and straight, not loading into it with my thumb. That rather defeats the purpose. Gonna load into that there. How are we with pain tolerance? Okay, so I'm gonna take the pressure off of it slightly while I load that, bring that up into that position. Perfect. And then I'm gonna load down. We still okay? Excellent. And then you're gonna slowly lower your leg down to the table. And I'm gonna let you do that actively. You can do it passively as well as actively. Works both. I like to do both, so do it passively and then actively. How's that feeling? Good, so we're gonna load in that again. And whenever you bring your patient's leg back up, you don't want to be loading into a tissue and then having them contract the tissue at the same time. It's very uncomfortable, as I'm sure you can tell us. So we're going to just release the pressure off that tool or off your fingers if you're using your hands or thumb. And then we load in, and then you lower back down. How's that feeling? Good. Excellent. Good. And then you want to kind of flush out anything that you've really been loading into. How's that feeling? Good. So now we are going to do, we'll just put that there for now. So we're going to get up and stretch that hip up a little bit. So you said the glutes in the back have been pretty uncomfortable. Mm-hmm. So I'm using my body for power. I am a teeny little person. So picking up somebody's limbs, especially the lower limbs, is going to be sometimes a little bit careful for biomechanics. You want to make sure you're doing that safely. So I am holding the patient's leg against my body for support. How's that feeling? Okay, so this is going to get a good stretch for the glutes. Now, depending on how far along your patient's pregnancy is, this can start to get a little bit difficult, but you can start bringing that across the body as well. It's just going to get more of a glute stretch, get those lateral rotators, the hip rotators in there. Very effective. How's that feeling?
Good.
Nice. So again, we want these stretches to be within pain tolerance. If they are making a face during them and going, that's probably a little bit intense, you want to back it off. Make sure that it's, if it were an intensity scale of 1 to 10, I usually say we should not be going past a 5 or a 6 for a stretch. How's it feeling?
Feels good.
Good.
Fibers.
And you can also just instruct your patient how to do this at home, bringing the leg to the other side. I'm resting her foot on this side of the table. You can always make sure to grab the edge of the bed and then lower that down. This is going to get a good stretch for the low back as well. How's that feeling?
Good.
Yeah. Then we're going to get you into that position again. We're going to stretch that up. How's that feeling?
Good.
I was doing this maneuver with one of my patients who is getting close to the end of her pregnancy, and she said, I feel like this would be great to do during labor. And it is. In fact, it's a great technique to do while your patient is in labor. Things are going really, really slow and you're wanting to increase opening up that pelvic area. This can be a really good effective thing to do. Massage therapy is really helpful during labor to kind of helps pass the time while you're waiting for things to happen. That obviously didn't happen with you. Your labor went nice and fast, but can be very effective.
There, but it went too fast.
Alas. Okay, and that's basically kind of where we're going to leave that. We've got lots of treatment areas to work on: the abdomen, neck, shoulders, pecs, legs, hips, all the things that you can do in this position, exactly the same as you would with any patient in the supine position.
We have just seen a wonderful treatment offered for our pregnant mom here expecting from the amazing Magdalen, and now we're going to go ahead and progress into some joint mobilizations that you might want to consider. So a couple of key things for contraindications. The biggest thing you want to do, of course, is always keep mom and baby safe. So no real firm pressure over top of the abdomen is what you're trying to avoid. Otherwise, setups can be modified and maneuvered into whatever position you want as long as you have consent and understanding from the patient who's involved with this. So when we're doing these kind of setups, we obviously don't have a pregnancy pillow here with us, so we're going to go ahead and stick to side posture and supine adjusting or mobilizations, whatever your scope of practice includes. Key thing here always, obviously, pregnant mom is not going to be able to lay face down. Okay, they tend not to like to mush their babies, so we'll try and avoid that. So first setup is going to be just a matter of keeping this leg straight, and this patient has actually never been adjusted or mobilized like this before, so it'll be new setups for her, I think. So if I can, mom, I'm going to have you come a little bit closer to the edge, even a little bit closer, a little bit closer. And we're going to kind of be in this position here. This hand, we're going to have you actually let your head drop. We're going to pull you back and put your hand over your elbow like this. And all I want to do is from here, you can flex the hip up a little bit, but I just want to bring her over and just traction around. And how does that feel for pressure?
It feels good.
Yeah, and how does that feel on your low back in particular?
Yeah, stretching.
Yeah, and so what you get for especially moms who are carrying a lot of abdominal weight, that pulls you forward, that extra pressure on their low back, they just love to have their back rounded out and a little bit more movement. Okay, so you can stop here and just do a gentle mobilization. I could switch it up if I wanted to a little bit and do more distraction. So if she just keeps her hand right there, we can load in and I can pull her back apart like that. Yeah, give me a big breath in. And then as she breathes out, always timing this with breathing makes it much easier. Yeah, and she's very flexible, actually, really good motion right there. And one more big breath in and all the way out. And this is 100% legitimate. A lot of people think they can't twist somebody around because they're pregnant, but you can feel how we were able to load in and move you around right there. We're going to go ahead and repeat that on the opposite side, and I'll have her facing the camera so you can see how I'm moving when we do this. So yeah, and look at what a well-trained patient, she already knows which direction to get into. Hips, you want them relatively close to the edge, so even a little bit closer. Okay. Key thing is, what are we in? Which pregnancy week are we in right now?
21.
Yeah, 21. So even out into the 30s, this can get further out here, but as long as you avoid excessive pressure, everything's going to be okay. And of course, good communication with the mom, always asking if anything is too much or more pressure or less pressure. So I like to just do a few checks to begin with, where I'll just load in, push across. How do you feel there?
Good.
Yeah. And big breath in. And then all the way out. Timing this with breathing just makes it a nice way for you to distract through. And would you be okay if we did a little drop right there? Mm-hmm. Okay, so we're just going to give a little push. Again, less force is better for these patients. The other key thing is she's got the hormone relaxin everywhere in her body starting to ramp up right now, so she is going to be a little bit looser. So, all right, big breath in, all the way out, nice and relaxed, breathing through, and I just load in enough, and just a subtle movement like that is all you need to start to mobilize. Okay, now we'll have her lay flat on her back. Okay, so you can do prone adjusting on most patients, but the issue is we've got the baby bump, the baby belly right there, so we can't get through that. So we're going to change this a little bit and use some supine techniques. Now, a couple of things for this to realize. Number one, we'll have you closer to this edge. This is a wider table, so if you're on a narrower table, you don't have to move the patient as much, but it depends on the size of your patient. You want the patient to love themselves. They have to give themselves a hug, so they grab around their lats when they're doing this, okay? She's really good at that. What I'm going to do is put my hand behind your back, and I'm going to push down on your arms a little bit, but all of my pressure has to stay up here. I absolutely do not want to load my body weight anywhere over top of the abdomen, okay? Key basic principle we want to make sure we maintain. So she comes over to the side like this, just a little bit, and in fact, I can tell we're going to load in right here and just bring you back. Big breath in for me, and she breathes out. As she breathes out, traction up, 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 up. Yeah, and just a little push like this, okay? For her, I can just feel a little bit of tightness. I'm gonna pick you up a little bit, again, avoiding pressure right here, but let me know if it's too much. Okay. You're just gonna lift your head up, and I'm gonna lift her up, and from right here, tuck her elbows into your abs, bring her up, and then big breath in if you can, and then all the way out. Out, 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 and gentle load in, and just springing, and there was a little popping with that. You notice how gentle that movement was, just nice and easy to extend back. Now, earlier in this one, we were looking at the massage treatment that was done. The question that you always have to ask, increase in breast size. Well, that increase in breast size comes with trade-offs as well. As you start to get more loading through the thoracic spine, it can be definitely an area of tightness and pain and discomfort for the moms expecting here. So always want to address that area, and then we'll finish off into the neck here a little bit, where I'll just move you around nice and light, and we'll see what happens there, okay? One of the key things here, always wearing a tie. This always goes well for patients when you do this and the tie's in their face. So take that tie, tuck it out of the way, and then you're going to go from here. So just nice light movements. Adjusting here will be the same as anywhere else, just moving her around. And Danica, are you okay if we do an adjustment here, or would you rather just mobilize?
Sure.
Okay. A little bit of tightness going this way. So just going to bring her over. So nice big breath in. And then all the way out, nice and relaxed. Heavy head, heavy head. Perfect. And a little movement like that. Less is more effective. So there's a little cracking that occurred right there. If you looked at the technique that I use, ultra low force, ultra safe technique. Big contraindications for any kind of massage or any kind of mobilizations or loading into the tissue for any pregnant mom is simply a matter of avoiding excessive stress over top of the abdomen. Otherwise, you can actually do a lot of the similar techniques, just making sure that you have good consent and good communication. All right, thank you very much.